So with Kelly today, we are going to do some injections to her face, both combinations of Botox as well as injectable fillers. The product we use for injectable fillers are Juvederm. The areas of concern for Kelly today is on her face is the frontal forehead area. When she raises her forehead, you can see that she does have some deep lines here. Okay. In addition, when she frown or bring her eyebrow in, there's also a very deep set of lines. What happened is that this muscle is very dynamic, and so therefore facial expression causes this muscle to work more dominant than anything else. And for Kelly here, this is her first time doing Botox injection, and as you can tell that her lines is already really deep when she's in a relaxed position. So when we do the Botox injection, the goal is to help relax this muscle so that way these lines will not be so prominent. In addition, with Kelly here too, when she smiles, you can see that she does have some lines here. These lines are called crow's feet line, okay, which is the corner of your eyes. Our goal is to help relax those muscles when she smiles so that way it doesn't show up. And that overall will give her more youthful appearance to her face. In terms of her mid-face, the nasolabial area, she does have a very deep set nasolabial. And what happened is that this nasolabial here is defined and is prominent because of her mid-cheek tissue has been relaxed. And so therefore it's sag down or hang down. And the nasolabial here is a defined anatomy. And so with aging or anything that causes your face to relax on the muscles and the skin standpoint, it's almost like a hammock. The mid-face tissue here hangs down, and that's why you have the deep set nasolabial fold. And so the goal is to do some injection. The injection we use is Juvederm. It lasts about 6 to 9 months. And what it is like a filler. It helps to kind of plump this up to soften it so that way it's not so deep. Perfect. So with Kelly's lips, she does show to have very deep set corner of her mouth, the oral commissure. And based on her history, this traditionally has been carried on within her family. That's what gives her this deep set. So our goal today is we're going to inject some Juvederm to help open it up, to give her a little bit more fullness, so that way we can try to see if we can bring the corner of her mouth up a little bit more to soften up her face overall.